There's nothing like a good health segment, and you're welcome to it. It's time for us to get into your health, find out what's happening to you, and we'll ask the doctor about it. It's Ask the Doctor today, and the phone lines are already open, so you should just call and ask the regular questions about your health. Let's say a big thank you to the Bank Hospital for supporting the morning show. You know, the Bank Hospital is at Cantonment opposite NAFTI, and they have all kinds of services for you. They have stroke clinic, there's sickle cell clinic, there's urology camp, and all of the great stuff. Okay, so you can call the Bank Hospital 030-273-9373, 030-273-9373, and you can call them, book an appointment, or you can just walk in and get your health checked out. Right, so today is Ask the Doctor, and it is not Dr. Joanna Ababil. It's the doctor from the Bank Hospital, Dr. Wisdom Effiong. Good morning.
Good morning,
It's good
precious
to have you back.
Biadelalistic Dale.
Where is the lipstick coming from?
The onus of grace and melody.
Ooh, I see now. Well, this is nurse on duty, and I'm ready to take all your vitals before I present your case to the doctor. All I'm trying to say is that just call, okay, and let's have a great time. But Doc, good to have you back. We've been talking about lots of stuff. Real quick, from the last time, we were stuck on this question on IBS.
Okay.
Right? And we also had a question about continual erection that wasn't going down, right?
Okay.
And the doctors were, kind of like killing that before time got caught up with us. So if we can start it from there, that would be great.
Okay.
So a gentleman called in, and he mentioned the fact that anytime he had sex, it will stay longer,
Okay.
before it would eventually go down,
Down.
And the doctors were saying that, there are conditions like that, except we didn't know. So, yeah, and then we were really scratching that before. So you want to tackle that for us?
Yeah, sure. A lot of people tend to have questions about sex. I don't know why, but
Well, sex is a very important thing.
Very
It was
important,
created
yeah.
by the Lord. Thank you
Yeah.
very much.
and exclusive to
Married people.
you
Yeah,
have to put
very
that out
married
there.
people.
Yeah, so if he's not married, I want to answer his questions.
Well, sad part, your next really asked whether he was married
Means you
or
didn't
not.
take a good history.
Sorry,
You take
Doc.
I always tell you, Biadela, the history is the bedrock of managing
Of
a patient.
diagnosis. Yeah.
You know, one of the episodes I was watching, and then someone said, "Oh, I had something I don't quite remember," and then you were asking, "What job do you do?" I'm like,
Yeah. I'm
proud.
Dr. Effiong trained me well.
I'm like, yeah.
Dr. John actually said that. She was like, "Oh, you're doing good."
I
And in my mind, I'm
see.
like, "You don't know the training I had." Yeah.
Okay, start bringing your offering and your tithe.
I'll do that. I'll definitely do that.
Yeah.
So,
like she rightly said, there are things that could cause erection
yeah.
to be continuous. And one of it is we want to find out if this person is on any medication. Some people tend to take medication to help them perform, right? And people take these medication and realize that, of course, it prolongs the time of, your erection,
Okay.
such that you don't even know, when it's go down, and then even causes you to feel pain as well. So we want to find out, perhaps he's taking one of those medications. Is it something that he's doing? I know aphrodisiacs and all that. And so that could be a cause of prolonged unwanted erection. Of
Okay.
course, it was initially wanted. Maybe the period has passed, but it's still there. That could be one of the causes. Another cause is sickle cell disease. Sickle cell disease could also predispose you to having an erection, prolonged erection. That's one of the complications, what we call crisis.
Okay.
Yes. So those with sickle cell, like I mentioned when we spoke about sickle cell, that because the blood cells are supposed to be oval in shape or round, if you like, And in sickle cell disease, they
Okay.
assume the shape of a sickle. So they tend to clog with each other, especially if you are dehydrated or you have any infection or any thing. Then this symptom can equally, in as much it happens in the joints, it can equally happen in the front passage or your penis, if you like. And it means that the blood goes into it, causes it to be erected, and because they are clogged within it, it's difficult to come back out. Yes, because the blood goes into it, causes it to be erected. Now, it's like you've put 5 million people into this room and there's only one exit. Now they are all struggling to go out. Now they are still crowded. People start dying. So that's what happens. And really, the management for that is trying to evacuate the blood.
How do you do that?
So at the emergency room, we tend to, create small channels, so use a
You
special
sort of
instrument.
perforate the thing.
Sort of, to dip into it, with warm fluids, just to ensure that some of them will be clogged, thick and all that. So you want to ensure that that is fluid and then keep pumping warm fluid. It's a whole procedure in itself, and then keep milking. So you'll be milking that out, Yeah, that happens. You'll be
Is that
you milk
painful?
till you. Yes, I mean, of course, before the procedure, you have to let the patient, you give them analgesia, adequate analgesia. They might not feel the pain, they might feel little pain, but you have to tell them that your erection might not be the same again. Right, so it might not be the same again, especially for those who actually take a lot of those medications.
Right.
Yeah, they are the ones, even as much as the sickle cell, not most of them have, that. But with those who take the medications, that have not been prescribed, they tend to have those prolonged erection that is not wanted. And we always advise them that, it wouldn't be the same again. Because, of course, you are creating channels and evacuating the blood. It would definitely not be the same again. But that doesn't mean that you would not have an erection. You would. So, yeah. So, I mean, those are the few things that could possibly cause. We have to know his peculiar situation and know exactly. Take a good history from him, to find out, is he taking any of these medications, perhaps? Because most people tend to rather complain of erectile dysfunction, as compared to prolonged erection.
Okay.
So with that one, there are a host of things that could cause erectile
Dysfunction.
But with prolonged erection, there are a few things that could cause that, and we need to find out his peculiar states.
I see. There was another thing about uterine fibroids. I was really hoping that, if Dr. Joan came, I would ask her. Because somebody asked a question. Let me get that real quick. It says, that's from Ophelia Assuming. She sent that last week. It says that there are many people going for herbal treatments and complicating their condition. Can you please speak to that? So we started to look at how we're going to, like we treated the food topic, what it is, what can cause it, and how it can be treated and all of that. And we spoke about how lots of people would maybe want to use other kinds of medications. And so this person was sending a message, said that people use herbal treatments and then they complicate these issues, so the doctor should speak to that. So,
yeah, so we of course want to speak for the kind of medicine that we represent, and for other kinds of medicine, we don't necessarily have much knowledge about it.
Right.
And that's why we can't, beat our chest to say that you can go for this herbal preparation, because we don't, really know much about it. And with what we know, there's evidence. We practice evidence-based medicine.
Okay.
There's evidence that based on this and this, it has shown, it has proven that it works on this. You see, and that's one thing that the herbal world lacks, really, evidence. I mean, I've seen a few, evidence, based on that. I mean, on other herbal preparations, but not necessarily with regards to leiomyomas, which are fibroids.
Okay.
You see. And so I always say that when people don't present to the hospital with fibroids, like, oh, I have fibroids, doctor, right? They'll present with symptoms suggestive of fibroids, right? Otherwise, they will present with something else, and then the fibroid will be an incidental finding.
Okay.
Do you understand?
Yeah.
You presented with maybe tummy pain as a result of a peptic ulcer disease. and then maybe someone happens to put a probe and scan your tummy and realize, oh, but you have multiple fibroids. Because she's not having symptoms of, the fibroids, in that case, you would do nothing about it. Or something called watchful waiting.
Okay.
We just want to wait and see. So we'll only treat fibroids when they start causing symptoms.
Okay.
Either symptoms by the essence of their existence in your uterus, means the presence, what we call mass effects. So some people try to get pregnant, but because the fibroid is competing with the womb space, so either the baby or the fibroid will have to give up. And almost often the baby gives up because you are now forming bones and all that. You're not very strong. These fibroids have been well fed like a bulldog's, so you realize that they are able to push the baby out, and then the fetus comes out as, miscarriage. So either the presence of the fibroid causing symptoms, or the fibroid, causes changes that would cause other symptoms like bleeding, lower tummy pain, and all that. Then we can say, okay, now, depending on the size of the fibroid, will determine what kind of treatment, the treatment could range from hormonal up to surgery.
Right.
Right. And in the worst case scenario, we have to do a hysterectomy, which is taking out the womb. And in that case, of course, with good history, we have to find out how many kids do you have? Do you have fertility wishes? What are your concerns? In everything in medicine, you also address the patient's concerns. Because that's why they are here. A colleague once told me about a patient that they were managing for some condition, but they found another condition whilst managing that condition. And the patient was like, that's not why he's here. He's here because of this. You see, I told you last time that erectile dysfunction can make people come to the hospital. Someone can come with erectile dysfunction, and then you have found that he has a pneumonia or perhaps an ulcer, a stomach ulcer. Then you are focusing on the stomach, but that's not his concern.
Right.
The fact that you found it doesn't mean you've addressed his concern. So you would have treated the patient holistically, but you've not addressed his concern. So the concerns are always important. That's why we always say that what is concerning to you, the woman, having this fibroid. So based on your concerns and then our line of management, then we can marry them together and get a proper line of management for you.
I see. Yeah. I see. Great. So that's for the uterine fibroids. You can call in. I know the weather is a bit certain way, but you can still try calling in, and then let's have a conversation with the doctor. And I also love your messages, I mean, for real, so that even when we are not able to attend to them now, we can do that later times. So this is from Vida Arthur. Okay, she says, the doctor, what are the top 3 health checkups every adult should get annually? I think we tried that with Dr. Sam, was scratching the surface on that. She actually asked whether it was a male or female, because then over 30, then we're trying to find what it is. So, okay, so we have someone calling from Lashmi, right? Hi.
Yes, please.
Good morning. How are you?
Please, I'm fine, madam.
Great. Let's hear you.
Thank you. First of all, I want to greet Dr. Wisdom. The opportunity he has given to us and the station and the staff as a whole.
Wow. Well, Dr. Wisdom?
Yes, doctor, please, there's this thing happening to me. My head, the right side, it's always touch. I don't know if it's a flash or something.
The
so
right
when it
side.
does that, unless I hit it or I shout.
Wait, your head?
Yes, my head, the right side.
The right side. And
yes,
when the
please.
pain is too much, unless you scream?
Yes, if unless I hold it and then scream, or I squeeze my hair so I can get some relief. So I don't really know what is happening to me.
Wow. Have you been to the hospital?
Yeah, whenever I went to the hospital and I explained, they'll just give me painkillers, like maybe that is a migraine or just a headache.
I see, and it still continues. For how long?
It has been for a long time, or more than 5 years.
Wow, interesting.
And another thing, whenever I I slept and woke up. My knuckles, the joint is paining me heavily, and then my knee.
Okay.
But after some time, after some time, the pain will stop. But every morning when I slept and wake up, I can feel that
Feel the
joint
pain. I see. How old are you?
It's 30 years.
30. Great.
Yes.
And what do you do?
Yes, I don't do anything. I'm always in the house.
Okay. All right. So Dr. Effiong is here to sort it out. Doctor, we're 30, headache, real serious headache, unless she holds a literally, I think I've been there, where you feel like you could just hold the pain and yank it out of your head.
Yeah.
Something like that. And also joint ache, which
Yeah.
wakes up.
Yeah. I mean, headaches are things that people really don't like experiencing, headaches and tummy pain.
Yeah.
People don't like experiencing that. But whenever, like we always do, we want to check out for the red flags.
Okay.
And ensure that we are out of that zone. And then that's why asking the age is very important to ensure that you're out of the red flags. And some of the red flags we're looking out for here, not to scare her, I mean, just a red flag. And that's why I would advise that she goes to the hospital and then they have that proper check. And we want to ensure it's not a tumor,
Okay.
Tumor. I mean, I'm starting from worse, to come on, because she mentioned it already today, it could be a migraine. So let me just go to worse things we want to rule out to ensure that it's not a tumor. And these are most of the times when you wake up in the morning, you feel the headaches, mostly at mornings. So, like again, taking a good history would help us identify that. And then we want to find out if she feels dizzy, any vision changes, because I mentioned that the eyes is controlled from the back of the head, so sometimes it helps you even identify the location of the problem.
Right.
So that she see double sometimes and all that. And we want to also find out if she feels dizzy. I mentioned that if she bumps into things. So some people can be walking, they don't necessarily see this and they bump into it.
Oh.
We want to find out that. And then we want to track the progress of the headache. Is this something that has become worse? She mentioned about 8 months.
Yeah, she said it's been there for some time.
Yeah. Is it something that's
about 5 years.
become worse over time, or that's remained the same? And with people like this, you want her to keep a diary of the headache. At what point does she feel it? Whenever she feels it, she should write down the day, the time, whatever she was doing and experiencing that headache, because sometimes it could be related to her menstrual cycle. Some people tend to have certain headaches, or called menstrual migraine.
Okay.
You only have it during your menstrual, around your menstrual. Some people have it before, some people have it during, some people have it after.
What could cause that? I mean, blood is flowing. What's the head?
The hormones are always up and down, messing up and things. So you see.
Okay, we have Portia on the line. Yeah.
Hello, good morning.
Good morning, Portia. How are you?
I'm fine.
Great. The doctor is listening.
Okay, so I want to ask the doctor, can you be pregnant and still have fibroid?
Oh, okay.
Because my auntie was complaining that she was having fibroid. That for now she's pregnant.
Right. So she complained she had the fibroid before she said she was pregnant?
She was having the fibroid before she got pregnant.
Pregnant. I see.
Mm-hmm.
Well, Doc, since she's not the patient, I couldn't.
Yeah. I mean, it's possible. The answer is yes. You can have fibroid and still be pregnant.
Okay.
You can have fibroid and still deliver your baby. The fact that you have fibroid does not mean you can't get pregnant. Does not mean you can't deliver your own baby.
The only thing is you need extra care.
Except, of course, we have to identify two things. Two of many things.
All right.
The location of the fibroid.
Right.
And the size of the fibroid. Like I mentioned, some fibroids are very big and then are located right in the the lining of the womb, what we call the endometrium, right? So it competes with the space of the baby, because that's where the baby grows. And this baby end up growing, reaching 3.5 kg, 2.5 to 3.5, for some babies are 4 kg and all that. So in as much as the baby is growing, because the baby is being fed by hormones and blood vessels, the same way the fibroid will be growing, you see. So that's what I'm saying, depending on the size of the fibroid, it will determine if, so they want to ask her auntie if she's been pregnant before and did she lose that pregnancy?
Right.
And how many pregnancies has she lost? Do you understand? And that would now tell you, and if she's ever done a scan before, it will tell us, okay, maybe the fibroid was, say, 3 by 3 centimeter, but now it's 5 by 5 in a space of 2 months. You get it? Maybe after 1 more month, it becomes 10 by 10. That's a fast-growing fibroid.
I see.
Who will definitely compete with the space for the baby. But some fibroids are just there, not necessarily even within the womb, but maybe outside of the womb. You know, yes, and they would not compete with the space. So yes, you can have fibroid and still be pregnant. Yes, you can have fibroid and deliver your baby. But then again, it has to be dependent on 2 things: the location of the fibroid and the size of the fibroid, as well as the rate of growth
I see.
of the fibroid. That's why you have to get it checked and then know that, okay, with this you can. So you want to know, is this something you want to remove before you get pregnant?
Okay.
Or is it something that
You can manage.
with that you can still get pregnant? Yeah.
I see. So there you have it. You can be pregnant and then still have fibroid. They can manage the 2. You can have fibroid, still have a baby. There's a prayer that my pastor always pray, that we pray the fibroid becomes a fine boy.
Fibroid.
Yeah, right. So pretty soon we'll be talking about fatigue, right? Faith and fatigue. But somebody sent a question. I really wanted to touch on that. I mean, this would be from the medical perspective. It said, how do I know if my fatigue is stress related or something more serious? So they're mostly tired. They're mostly, fatigued. They wake up tired. I know lots of people like that.
Yeah.
The smallest thing, they're so tired. They climb the staircase. They want to, just literally die.
Yeah.
So she wants to know, it's from the same author. She wants to know, how are you able to tell if this is, stress related or something serious that can contribute to fatigue?
Yes. So, I mean, when you mention fatigue, tiredness, you want to ask the patient, what exactly do they mean? You understand? What do you mean by fatigue, tiredness? Is it that when you are there, you're always tired all the time? All the time, like you're just tired? Or you're only tired when you exert yourself, when you do some strenuous activity? Some people just get tired by walking a flight of stairs. They are tired. Or when do you get it? So you want to find out, what exactly do you mean? When did they start? Or what has the progress been, right? And there are so many things that could cause tiredness. We usually say there's an ABCD of tiredness. There's an ABCDEFO of tiredness.
Right.
So if you come to my consulting room, I will run through those questions, ABCDEFO, of tiredness. Finding out, do you have anemia?
Right.
Do you understand? Anemia could make
Your
you feel
HB is
tired.
low.
Exactly. You have a low blood levels. It could make you feel tired all the time. Do you understand? So if you go to the hospital and you check your blood level, you see that it's 9 or 8 or 7. You realize that, then this is actually the reason why you are tired.
Yes.
Do you understand? I want to rule out any, bone pain. Do you have bone pain? I'll be looking at some bone cancers can cause tiredness.
Oh.
Yeah, tiredness all the time. There's something we call chronic fatigue syndrome. It could also cause tiredness all the time, right?
I'm going to have to, so that you don't get tired.
Yeah.
There's Frank from Insawam on the line. Good morning, Frank. Hello. Hello.
Hello.
Hi, great. We can hear you clearer now. Hi, Frank. Yes, you can talk.
My name is Sam, calling from Sawam. I'm having this severe waist pain. I'm taking painkillers. It goes and comes, I want to know if the doctor
what it is. Frank, please, what do you do?
I'm a pastor.
You're a doctor?
Pastor.
A pastor? Oh,
yes, please.
Okay. So I'm guessing you sit a lot and also stand a lot.
Yes, please.
Yeah. I don't want to. Can I ask of age? Yes. Pastor, please. How old are you?
I'm 45 years.
35. Right. So severe waist pain. Please, for how long have you had the waist pain?
It's been over a year now. It goes and comes.
Right. Okay. Dr. Effiong?
Yes. So I think we've dealt with waist pain.
Yes, a good number
Waist
of
pain.
times.
Nobody likes waist pain.
Well, I mean, nobody likes pain.
Yeah.
However, there's no pain that's pleasant.
Nobody likes waist pain at all. Especially because they tend to be long term most of the time, right? And then it's not like a fever where you take this medication and it's
And
gone.
then it can go.
Yeah. So we would want to rule out red flags. Things like, are you able to pass urine well? Are you able to hold your urine?
Okay.
Bladder control. And then, are you feeling any tingling sensation or numbness in your legs? That's also another red flag, because we want to rule out what we call cauda equina syndrome. So what your spinal cord has been, severed or probably maybe squeezed, such that you don't have control over the things down there anymore.
Right.
Those are red flags. Some people tend to have numbness around their anus, perianal numbness. So that's another red flag. So we want to find out, can you control your bladder? Can you control your bowel? Some people are there with cauda equina or severe back pain. They can't control their bladder. They feel like urinating, it just comes out. They have numbness and all. So those are red flags, which is an indication for surgery, right? It's an emergency, right? Now, if we've ruled out all those, now I want to find out, the last time I was saying that there could be medical causes or infectious causes of back pain. Your kidneys are behind you.
Yes.
You want to find out, do you have a fever? Do you have chills? Are you vomiting? So there are so many things we want to ask. But if it's something that has been with him for a while, then it means that he's not, perhaps, if he's having a fever, he would have mentioned
exactly.
it. Right?
Exactly.
Not one of the things that he's thinking about. So you also want to find, how did this start? Did you, was it sudden or it was gradual? Now, gradual pain will usually be as a result of posture, sitting the wrong position all the time, or maybe standing all the time. That would be gradual, to start gradually. But sudden, let's say you bend down to pick up something, you bend down to pick up an item, not necessarily heavy, but that's, act just, then you get a sudden severe pain. You're talking about a disc, slipping through now. So most of the time, we manage this pain with pain medications and physiotherapy. Once we have ruled out, all the red flags, right? Yeah, you want to manage, because sometimes it could be that your muscles are tensed, muscle sprain, your muscles are tense and all that. So you want to give some medication. Then physiotherapy.
Okay, so we have a caller from Nigeria.
All right.
Good morning, Boniface, all the way from Nigeria.
Morning.
Good morning. Yes, we can hear you, please.
Okay.
Good morning, Boniface, all the way from Nigeria. Good morning, yes, can hear you.
Hello? Oh, no.
Network.
Hello, Boniface.
Hello?
Yes, can you hear me? Please reduce the volume of your TV set so that we can clearly hear you.
Lost him. Yeah.
Yeah, well, the cross-border calls couldn't work, but please keep trying. So, yeah.
Yeah.
We
So
can get back to
yeah. So I think, yeah, like I said, I mean, physiotherapy, physical therapy, can help him. If he goes to see a physiotherapist, they'll show him some exercises he should be doing that could help him, alleviate this pain.
I'm looking at this guy, not the guy, the man of God. And I mean, the fact that he's a pastor, I'm thinking through his routine. I'm thinking he's standing a lot, like preaching.
Yeah, sitting a lot as well.
Sitting a lot in study, walking about probably in prayer.
Yeah.
Like for long hours. Yeah. For somebody who does that, I mean, if you're asked what do you do, pastor is the very first, that means he spends more time doing that. What would you advise they do in the interim before they even come to the hospital? Yeah,
so modifying the way you sit, one. Secondly, how frequently you stand up. Okay. The last time I was saying that.
Yes.
Yeah, with some smartwatches, I tell you that you're sitting for a long time, get up. So you get up, walk around, and then you go back to sit. You see, because with that way, because truly, it's difficult to maintain one sitting posture for a long time. You just have to get up, because people tend to ask, what is the right way? Even after knowing the right way, you have to ensure that you don't even stay there for a long time. Right. You understand? You have to also get up, walk around, pace about. And I told you how at work sometimes, in between patients. Just get up, stretch.
Yeah.
Stretch yourself and then go back to sit. At least that helps to like remodulates the structure of the muscles. These are tensed muscles. If you're in a particular position, the muscles will contract and will be contracted for a long time. But if you realize you've done a little stretching, we are trying to, that's like a bit of therapy.
Right.
Trying to modulate, tone up the muscles a bit. So that's something you can actually do.
Hydration
Maybe he
does help?
not. It would. I mean, hydration helps with everything, right? But specifically looking at the position where this is coming from, the lower back, we know that the muscles always over there tends to get tense most often. And considering his job, he sits for a long time.
Yes.
So these are things that he wants to do, because most of the time people don't like stretching. People don't like doing little bends here and there, gently. So those things help to lighten up the muscle a bit. So those are things that he could do before visiting the hospital.
All right. So that's it for the doctor for today. Thank you so much, Dr. Wisdom.
Thank
Good
you.
to have you again.
Thank
Yeah, but I mean, we're still rooting. So I think that now you need to send me a message. Who do you enjoy most? Dr. Juan or Dr. Wisdom? But don't worry with us. There can always be a fine blend between the two. You can bring Dr. Juan again then with Dr. Wisdom. But thank you so much for coming through.
Thank you.
And that's it for Ask the Doctor. We have a lot of discussions coming up. Fatigue and faith. There's going to be a discussion with Benestelle, how she goes about it and doing it, and how you can also learn from it and blend the two, even in the marketplace. And you don't want to miss that. Up next is sports. Let's go for a quick turn.